It's a pleasure to have you here this morning.
Thank you very much.
The North has been under attack for over a year and a half now, and you've dealt with a lot of challenges. How did the war change your day-to-day life?
Well, running a hospital under direct threats is a challenge to make sure that everyone gets the proper medical care, even when your staff arrives to the hospital with missiles and alarms. Some of it is recruited. And most of all, the atmosphere in the North during these times is very challenging. But having said that, being able to be a source of resilience for the citizens of the North is a theme that encourages my staff, my team, to continue with the work.
It's also showing everyone that, you know, the show must go on under attack. And what were the biggest challenges you dealt with during this war?
Well, there are three main challenges in times like this. First of all, as I said, delivering continued medical care, even though some of the hospitals in the North went underground and closed their gates for many of the services. We continued almost 100% of our services, not only to the regular citizens of the Eastern Galilee, but also to tens of thousands of people who were evacuated from their homes up north and came to the regions of the Kinneret and Tiberia and other municipalities surrounding us. And we had to make sure that they get the treatment that they need. The second thing is, of course, being able to provide care for injured civilians and soldiers and children. We all remember the event in Majd al-Shams where the children were injured and killed over there, and we also took care of some of them. And, of course, keep looking ahead and knowing that we should be able to provide more services to the region, mainly rehab and mental health, which are probably the main issues that the Israeli healthcare system is going to be dealing with. She's dealing with these days and is going to be dealing with in the future years.
And you've seen rise in need for mental health care. I know you opened a rehab center in the North. What is that for?
Yeah, in recent months we've opened the first and only rehab center in the north of Israel. And when I say north of Ra'anana, offering all kinds, north is a rather wide definition. Yeah. And we offer all range of rehab services in the Helmsley Rehab Center that was opened a few months ago. And we are working now on a mental health facility on campus, again, the only one that will serve the northeast of Israel. And until it will open its gates, we are establishing a resilience center inside the Helmsley Rehabilitation Center in order to provide care for those who need physical rehabilitation, but also mental rehabilitation.
Yeah. And how do you bring great doctors up north and make them stay there?
Oh, that's easy. Well, the main challenge is indeed bringing top talent to the north. It's not only doctors, it's doctors and nurses and all the allied medical professions. And we understood that, and in the past 2 years, we joined hands with partners, with the local municipalities, with ministries, and we actually established a program that deals with relocation to the north and we want to promote top medical professionals to come and work with us. We understand that the North is less attractive now, and we realize that we need to offer more than just, salaries. It's not enough. So we established a hub. We call it AIR. It's the combination of academia, innovation, and research. And we understand that young physicians and young medical professions look for other things when they look for a working place. They look for challenge. They look for a place that they can bring their ideas to life. On top of that, we help them to find housing. We help them to find proper education places for their children and employment for the spouses. So it's a complete package that helps us to bring top medical professionals to the North.
And have you experienced some doctors since the beginning of the war that decided to leave the North?
Actually, we didn't see that. Those who come to work in the North do it with a mission. They have a commitment to the North, and all of them stay there. Nobody left.
And tell me, what's your long-term vision for health care up north?
Well, the vision of Tzafon Medical Center throughout the years was to close the gaps in healthcare services in the North. And I believe, even though it is the government mission, it is our vision and mission to work together with ministries, and we do that. We work with the Ministry of Health and the Ministry of Negev and Galil and others, and the municipalities in order to close these gaps. Some previous speakers spoke about revenues for investments that they recommend people to do. They were talking about 40% or 60%. I urge you to invest in the healthcare system in the north of Israel, and the revenue is much more than percentages. It's quality of life, it's accessibility to healthcare services, and it's being able to be an attractive landscape for people to come to the north and make it strong. There is a slogan, let's rehabilitate the north. And even though we just opened a rehabilitation center, I disagree with the term rehabilitate the north. I think that we should rebuild the north and make it strong and attractive, and healthcare and education and employment are the three most important things that will make it strong.
Definitely. Thank you for coming, and thank you for sharing these such important mission. Thank you.
Thank you very much.